One of the things that makes patient care interesting but also complex is the fact that vast majority of patients very rarely only have one pathology that's causing their pain. It's very rare that you have one person who their only pain generator is one thing, and it's an easy thing to figure out and it's an easy fix. So some of it is patient expectations, as far as setting realistic expectations of what the process will involve. And I tell patients all the time, it's a process. Sometimes there's no one magic thing we can do and it's going to be like, that's my fix. Sometimes that is the case. And I think one of the things that I've been very deliberate about is setting realistic expectations for my patients. Some patients I'm able to get them pain-free. Some patients I'm never going to be able to get them pain-free. And if I'm upfront about that from the beginning of our patient-physician relationship, then they understand the process as we go through it. Usually, when I'm evaluating a patient, I like to get their opinion and kind of explain what I think their different pain generators are and ask them which one they think is contributing to the majority of their pain currently. Because pain it's got layers to it, and those layers oftentimes overlap. So if you can take away one component of that pain, then you can reevaluate and say, okay, now what do you experience? What are your symptoms? And you see what it's most consistent with, and then target that. So I tell patients it's a very deliberate approach to treat their pain generators. But anytime it's multifactorial, usually I go after the one that seems to be causing the majority of their symptoms. I can't tell you how many patients I see, they've had spinal fusion, so they've got degenerative disc disease, they've got chronic radiculopathy, they've got chronic sacroiliitis from their fusion, and on top of that, they've got bursitis. You can't target all of those pain generators at the same time. Partly then you run the risk of side effects, run the risk of adverse outcomes, then you run the risk of not having any idea why they feel better if you use a shotgun approach. So if you explain it to them, oftentimes patients say, that makes a lot of sense. Nobody's really said, these are all the things that are causing your pain, this is causing this part of it, this is causing this part of it. So I think the more you explain to your patients, the more they're able to really understand what's causing their pain, and then they can really be on board with the treatment plan that you come up with.